record the class.
All right. Okay.
And after that, once I've got the file, I will give it in. I've created a Google Share document folder to share all these videos.
Okay.
Okay, thank you very much.
Thanks for the call.
I shall leave soon. Thank you. Bye bye.
You
Have fun.
passed the host to me, right?
I made you co-host already. Actually, I made all the teacher co-hosts.
Okay. All right. Okay.
So I think I can leave code. Then you will be host code.
Okay. As long as I can record. Anything, I will contact you if I cannot. Thanks,
Okay, so maybe I leave, and then if you are not, if everything gone, we try. I just leave lah.
Okay,
See
okay.
everything is okay or not.
All right.
Okay.
Yeah. Okay. Can record. Record in cloud. Okay, excellent. Good morning, everybody. This is my first meeting with all of you, and hope you all are doing well. All I can just see are blank screens and names, so I have no idea who I'm talking to or what you guys look like. If your connection is good, could you just just turn on your video for like 10 seconds? I just want to see like which batch this is and who you are. And okay, great, awesome. So most of you are back in college, right? Or around Sedang area, correct? Yeah. Yeah, I don't know any of you guys. All right, so this is new. Okay, this is very new. Okay. Alan looks familiar. Okay. Sexy creature, Kirsana. Azik, your roommate baru bangun ke? All right. Great. Most of you are in college, is it? I see the background is mostly like college background. Okay. Shell. Oh, awesome. 2 pages now. Great. Let's see. Alicia, Hazik. Awesome. All right, so I have a brief idea of who you guys are and what you do. Okay, so how has the new semester been? You guys can talk. If you don't want to talk, you can feel free to chat. That's fine. I can read in the chat as well. This is like what, the third day of the semester. How does it feel like to come back to UPM? Do you miss your bed at home? Oh, wait, this is the recording. I better not say. Yeah, so welcome back to UPM, I guess, right? So have you all started any of your practical sessions yet? No, okay. So that will only happen, is it later? Is that going to be later? Or depends on the course?
I think this Friday, Dr. Papato.
This Friday, your first, okay, that's exciting. It's Pato, okay, right. So at least you get some hands-on, I guess. Okay, that's very good. So, all right, so I will start. So welcome to Clinical Medicine. Clinical Medicine 1. So this is your foray into more medicine, more clinical courses, which just means that it just gets more and more difficult lah. Okay, so welcome. I'll share my slides. Hopefully you all managed to get my PowerPoint. Are you all able to access in Putra Blast? Yeah. This is me. Okay, excellent. Jana. Miyapan, thank you for your response. All right, share my slides. Are you seeing the large animal one, or are you seeing the small animal one?
Large animal.
Large animal.
Large animal. Okay, excellent. Everybody has this. Right. So, okay, so at any point of time during the lecture, it's a bit difficult because if you have any questions, please feel free to type in the chat. If you have questions during the lecture, you can also unmute yourself. But I highly encourage you, if you want to ask questions verbally, to do it at the end of my slide. So I finish one slide, then you ask questions. Because if you ask me halfway, I don't have very good memory, so I will be like tend to I don't know what I'm talking about. So it's very difficult for me to get back into the groove. Right. So if you have any questions you want to ask, please ask at the end of the slide. If not, you can type it in the chat. Okay. Right. Throughout the lecture, if you want to give reactions or whatever, just feel free. Okay. Like to support or like thumbs up or clap or whatever. I'm totally fine with that. Yeah. Good job, Azrin. Okay. All right. So let's start. All right, so this morning we'll be talking about neonatal management and diseases. So we'll be covering two portions. All right, so the first one will be large animal, and then the next hour will be small animal. Okay, so clinical medicine, VPK 3613. So make sure you guys are in the correct room. All right, so objectives for today, learning objectives for this morning would be, first of all, to understand and be able to provide critical care to newborns, as well as to identify common diseases of neonates and the corresponding treatments and preventions. Okay. All right. So first of all, let's talk about the term perinatal period. All right. So perinatal period, if you look at the words perinatal period, it just means that the timing that happens around delivery, right? Around the delivery of the fetus, and it is deemed as one of the most hazardous times. Now, why do I say this? Is because a lot of calf mortalities occurs at the time of birth. So about 60% of producers reported that they see deaths occurring in the calves during the time of birth. And so we term this death that occurs above stillbirth. Okay. But when you look at the word stillbirth itself, it can be a bit of a misnomer because stillbirth encompasses animals that are born dead as well as animals that are born alive but die shortly after. So essentially, it's not really stillbirth. So what I would like to do is that I normally use the term perinatal mortality. So perinatal mortality encompasses the time of calf death that occurs before, during, or within 24 to 48 hours of calving. Okay. So according to NAMS Dairy in 2007, NAMS Dairy is just a North American health management system. So they collected like this huge ton of data and they analyzed it and they saw that about 8.1% of all dairy calves that were born are stillborn. And according to me in 1991, they studied that deaths that occurred within 1 hour of delivery was about 75%. Postpartum, about 15%, and prepartum is about 10%. So this goes to show that about 90% of these calves which died were actually alive at the start of calving. Okay. And then over 50% of this mortality is due to dystocia, right? So dystocia is defined as difficulty in giving birth, difficulty in parturition. You might have heard like different ways of pronouncing dystocia, dystocia, whatever, and you think like, hey, why Dr. Mark, why does he pronounce it so weirdly? Well, actually, it is pronounced dystocia. Okay, I'm just going to share with you real quickly how to pronounce dystocia so that you don't think I'm crazy. Okay, here. Tell me if you cannot hear my. Give a thumbs up if you can hear.
Dystocia. Dystocia.
Right. So if you like the English pronunciation, that was American.
Dystocia.
Dystocia. All right. So whichever way you want to pronounce it is dystocia. Okay. All right. Everybody say it with me, although I can't hear you. Dystocia. All right. Excellent. Yeah. Let's go back. Right, so we all know how to pronounce this. All right, so what are some things that you need to think about, or what are some things that you need to do immediately after birth, especially when you are dealing with instances where there was difficulty in giving birth, so like dystocia, whereby the neonate or the fetus or the calf that was born is having difficulties. So we always think about ABC. Are you familiar with what ABC is? If you all heard of what ABC is, can you just type 1 in the chat? If you haven't heard of ABC, type 0. You might have covered this during your I don't know, have you done anesthesia or any like emergency or those of you that were in like Pengangkap or PBSM or whatever, you'll learn about the ABCs. Type 1 if you've heard of what ABC is for resuscitation. Type 0 if you have not heard. All right, so most of you have heard of it. Okay, yes, airway breathing circulation, very good, especially if you read my notes, but no cheating. All right, so first of all, A stands for airway. Okay, so you want to make sure that the airway is clear. So what you can do is that you can try to get rid of any mucus that is present in the external nares, the buccal cavity. And the way you can do this is you can do it via suction. So suction, you can use syringes to aspirate out any mucus. You can use catheters that are attached to a vacuum pump to help with suction. You can use your hand to like draw fluids out, or you can even do kupach. So kupach is pretty much where you have you heard of the term kupach before? Type 1 if you have, type 0 if no. All right, so mostly no. Okay, so kupach is pretty much your putting your hand in the shape of like a cup like this, all right, and then you're hitting on the lateral portion of the thoracic cavity, right? You want to have a sound like like a, I don't know whether you can appreciate that kind of sound, right? So I don't have a real life animal here, but pretend this is like your calf or your kid or whatever. So you're actually hitting on the thoracic area, all right? And then you want to hit it. The reason why we want to do kupach is that you want to make sure that any mucus that is lodged within the lung or thoracic cavity to be loosened, so that the animal can cough it up. Right? All right, so next will be breathing. So you want to check the breathing of the animal. Okay, you want to see, is there any spontaneous respiration present? All right, is there an inspiration, is there expiration? If the animal appears to have difficulty in breathing or maybe cyanotic, what you can do is that you can give some form of oxygen supply. Okay, especially in a hospital environment. Okay, you can provide oxygen. Next would be circulation. So you want to check for the heart rate. You can check for the pulse rate as well as any reflexes. Pulse rate, do you guys know where to get pulse from? You can just quickly type in the chat where you guys can take pulse from. Which artery can you get it from? Yes, Zian, femoral artery, yes, you can get it from the femoral artery. So that's typically where we want to get it from. There are also other areas, okay, but femoral is normally where we can get it from. All right, so the next thing that you need to do is that besides checking for ABC, you need to absolutely make sure that your animals are on sternal recumbency, right? You cannot leave the animal lying on its side. You always have to make sure that it's lying on its sternum, okay? The reason for this, I just cover a bit around. The reason for this is because if you allow the animal to lie on its side, inflation of the lungs can occur on the portion that is not on the ground, right? The portion that's on the above, that's above. So the portion that's lying on the ground maybe have difficulty for inflation. But if you put the animal on sternal recumbency, there is a good chance for both sides of the lungs to be expanded properly. So always put it on sternal recumbency, right? And then sometimes we can also see umbilical hemorrhage, meaning that from the umbilicus, sometimes if it's severed roughly, or there's no proper ligation that happens, what happens is that there's a lot of bleeding that can happen. Right? So if the hemorrhage is very severe, what you can do, you can just clamp it with a hemostat and you can ligate it with some sutures. Okay. But typically, we do not ligate if there is nothing wrong because we want to promote drainage. Only if there's very heavy hemorrhage, then we can consider putting like a ligature. All right. So going more into this sternal recumbency. So as I mentioned earlier, you want to maximize the ventilation of the calf, and also prevents hypostatic congestion in the dependent lung on lateral recumbency. So for example, if your calf is on lateral recumbency, the left side or the left portion of the lung will have hypostatic congestion. So you don't want that to occur. You want it to be on sternal recumbency, right? And by putting the animal on sternal recumbency, it also helps to give like a positive impact on the physiologic adaptation mechanisms, which is great. And also facilitate attempts at any positive pressure ventilation. Positive pressure ventilation is like when you're putting in like a EDT tube and you're pumping using your IPPV bag, for example. Okay, like your MBU bag, you all know what MBU bag is? 0 for no, 1 for yes. All right, good. All right, so MBU bag is like no, no, yes, no. MBU bag is like when you intubate an animal into the trachea, all right, and then there's like a portion of the tube that's sticking out, and then you connect it to a bag that helps you to give ventilation. That you can pump air inside. So that's an MBU bag. Okay. You cover this more in your surgery class, I think, surgery 1, which is this semester. This semester, yeah. So you probably will cover during that. You cover IPPV, like intermittent positive pressure ventilation, stuff like that. You'll be covering that in your surgery. All right, so in terms of resuscitation, you can do a pharyngeal and nasal suctioning. So you can use a vacuum pump. So this is a case from it's taken a few years ago. This is like your super seniors, okay? So this was a case of a Jamna Pari that came into the wards with pregnancy toxemia, and then she had three kids. So we managed to remove it via C-section, and this is your seniors trying to remove mucus from the buccal cavity, from the oral cavity. So you can see here she's using a syringe to try to aspirate the mucus out. All right, so you can provide oxygen, it improves survival, and yes, so in this case we are giving oxygen through like a conical mask, right? So we can, this is connected to your anesthetic machine that is connected to your oxygen supply. Then we can give oxygen, right? So this is a form of IPPV. So this is where they use like another cone goes over the muzzle of the calf, and then this is like a, you know, have you guys like blown up balloons before using like the pump? Does that sound familiar? Have you all heard of? Like sometimes if you get too tired of like blowing up balloons using your mouth, you use like a pump. You all know that? Yeah, so it's pretty much like this. So instead of blowing up the balloon, you're not blowing up the calf, but you're like you're giving oxygen or you're giving air, you're pumping air into the calf using this method. And also you want to put it on sternal recumbency, right? All right, so another thing that you can help to encourage like reflex or breathing reflex is like when by pouring water into the ear or over the head or whole body of the calf. So this can cause like hypothermal stimulation to induce the gas reflex. So they can use cold water. Like when you guys, like you guys at college don't have access to hot water anymore, right? So like in the morning when you turn on the shower to take bath or take a shower, and then the water is normally very cold. So what is the first reaction that you get when the cold water hits you? Like, do you like normally like you gasp, right? So that is what you want to, you shiver, yeah, you gasp, you shiver. So that is the kind of reflex that you want to induce in the calves if they are not breathing, okay? Right. And then besides that, Liana already said, tak ada air panas, is it? All right, so besides that, what you can do is that you can give, you can do acupuncture right at the philtrum. So this is this will help to stimulate the inspiratory initiating reflex. So philtrum is right here. I have a picture of it, yeah. So right here, this is the philtrum area where you can introduce a needle. So this also help to induce the inspiratory reflex. Besides that, you can also use other pharmacologic stimulants such as doxapram, epinephrine, or your adrenaline. Atropine, for this one is mostly for low heart rates, as well as sodium bicarbonate if you want to battle like metabolic acidosis, for example. Right? Are you all familiar with metabolic acidosis? Have you heard before? As usual, if I ask question, 1 for yes, 0 for no, or thumbs up also can. All right, so you've heard of metabolic acidosis, right? So you know sodium bicarbonate is an alkalinizing agent. So you want to counter your metabolic acidosis by giving a alkalinizing agent. All right. All right, so another thing is that I don't know whether you guys have done practicals in ruminant farms before where you see births of animals or even a small animal. you can see that some producers like to swing or suspend their neonates from the back limbs. So the reason why they do this is they say they want to try to get rid of as much mucus as possible from the respiratory tract. Or some even kind of swing the further, or swing the further. Right? Are you guys familiar with Matilda? It's a really old movie by Roald Dahl. Oh yes, you know where? Oh yeah. Oh wow, great. You know where the teacher, I think Mrs. Trunchbull, she kind of swings Matilda using her hair. So something like that, okay? But you're swinging the neonates on this. If you guys don't know what I'm talking about, you all can Google it. Matilda Trunchbull swing. Okay. All right. So, but the problem with doing swinging or suspending a neonate this way is that what happens is that you will increase the intrathoracic pressure. So imagine like you're hanging upside down. What happens is that all your abdominal organs will be putting pressure on your diaphragm. Okay, so for your diaphragm to actually be lowered and for your lung thoracic area to expand will be more difficult. All right. Compresses diaphragm with your GI organs. So, and then besides that, sometimes the fluid that comes out from the mouth is not necessarily from the respiratory tract, right? It can be actually fluid from the abomasum, right? So if you think, oh yes, a lot of fluid is coming out from the respiratory tract, it could just be fluid from the abomasum, okay? So the safety of swinging or suspending neonates is really questionable, and I do not encourage you to do this. If you really need to do it, what I can suggest, you just do it briefly, and then that's it. Put the animal back on external recumbency. Okay. Have you guys heard of this veterinarian, Dr. Paul? Ever heard this guy before? Yes, some yes, yep, some yes, yep, some no. Yeah, all right, excellent. So I'm just gonna share with you a video which features Dr. Paul. Let me just close this. All right, so have a look at this video, and I want you to pay attention to what he does, and I want you to analyze the video and think about things that he is doing well, which you think, yeah, he's doing well, I should replicate it when I encounter such a case. And besides that, another one is things that you think can be improved on, or things that you feel that you wouldn't do. So come up with these two things, right? Because I will ask later, okay? I'll just open, right, and I'm just gonna play. Tell me if you can't hear the sound. Give a thumbs up if you can hear.
Okay, I got it. You got it? Yeah, I got it. Right outside with it, okay?
Yeah. Oh man, she's a big guy.
Yeah, she's a big bull calf. Hurry up. Come on.
I'm getting it.
Watch out. Move. We put water on the calf to shock it. When you get a pail of cold water on your head, like all those football coaches do, you go, and you start breathing. Come on, breathe. You still could hear there was some mucus in the throat. Okay, Charles, pick up that leg. Yeah. Here, give me the other one. So then we pick it up by the hind legs and swing it back and forth, and all the mucus flies out and down. There. Ha!
There it goes.
One more time. Come on, buddy. Yes.
All right, excellent. So you all saw that. So what do you think are some things that you feel? Hang on, let me close this window. I feel that could have been that he's doing well. What are some things you think? You can unmute or you can chat. Totally up to you. Or some things that he's doing well, or things that you would also replicate if you see a problem like this.
Cold water?
Cold water. So yes, good job, Farha. So pouring cold water. So he demonstrated that shivering thing much better than I did. All right. So yes, cold water. What else? What else?
Removing the mucus using his hand.
Yep, removing the mucus. Yep. Thanks, Mira. Anything else you
He's
think?
just swinging it briefly, not doing it a lot of time.
Yes, he only did it briefly. Okay, not many times. Okay, thanks, Faha. All right, briefly. What about things that you feel could have been improved on?
The cough wasn't on sternal recumbency.
Yes, the calf wasn't on sternal recumbency. He just left it on lateral recumbency. So I highly recommend the moment the calf comes up, you put it immediately on sternal recumbency. Also, I don't know whether you noticed when he was swinging the calf's head like dish keeps hitting the ground. So that's not very pleasant also. Okay. And then another thing is that we will talk more in theorygenology class next semester. But typically, when we use a calf jack, we will try to pull the calf out in tandem, meaning that together with the straining of the calf. If the calf strains, that is when we crank on the jack. Okay, we don't crank on the jack if the calf is not doing anything because that one can cause a lot of injury. Yeah. Right, let's keep going. All right, so in terms of maternal bonding, we know that for dairy cattle, they normally are separated at birth. Okay, but goats typically we can keep them together, or beef cattle also can keep them together. All right, so just want to share with you from our experience. So this was the goat that came in, and then with pregnancy toxemia, and we did C-section. So what happens is that immediately after the kids came out, we dried them very well with towels. As you can see, they're all like very fluffy and clean. And then we introduced them to the mom. But the problem that we faced was that because we did such a good job at cleaning them, that there was no mucus or anything left on the kids. So the mom, like she did not accept the kids at all. So she did not allow them to suckle from her, did not allow the kids to come near her, which is a big problem, especially if you have a farm, because in order for you to hand raise goats, it's very time consuming. Okay, it's very time consuming. So in the end, your seniors had to do 24-hour rota just to feed the babies lah. And then like a year later or so later, she came in again with the same problem, pregnancy toxemia again with triplets. But this time, what we did was we made sure that we didn't clean the kids as well. We made sure that there was mucus left on the kids so that the mom can go and lick the kids off. And then the second time around, she accepted the kids, so we didn't have to stay back to for them to suckle. I mean, we didn't have to stay back to hand raise them or bottle feed them. She could just do it on her own. So it's much easier. So remember, do not dry them too much because you need the mom to recognize the kids. All right. All right. So besides that, at the time of delivery, you also want to check for this thing called colostrum. So colostrum is this thick yellow secretion. It's also known as the first milk. All right, the first milk. And it's present before and about a week after parturition. So it's a very thick yellow secretion. The moment it becomes a bit like whitish, then you can tell the colostrum is turning more into like normal milk already. All right. So colostrum is really important because it is rich in maternal antibodies, and it's important for the transfer of passive immunity. Right, super important for the transfer of passive immunity. And the most immunoglobulins that are present in your colostrum are your IgGs. Okay. So if you want to compare colostrum versus whole milk, all right. So this is colostrum milking postpartum. So your first milking, second milking, and third milking compared with normal milk. You can see like in terms of your Ig percentage, colostrum at the first milking and even second milking is very, very high compared to just normal milk, right? Which is why it's super important for you to give calves or kids or these neonates for them to receive colostrum. It's super important. All right. So when we talk about feeding colostrum, we talk about 3 cues, all right, for you guys to remember easily. So the first cue is quality. The second one is quantity. And third is quickness or timing. Right? So repeat after me. First Q is quality, second is quantity, and the third is quickness or timing. All right. Okay, let's break down one by one. So in terms of quality, how can we measure the quality of the colostrum? How do we know whether is this a good quality or is this a bad quality colostrum? All right, the way to do this is we can use this thing called a colostrometer. Right, so this is what a colostrometer looks like with a measuring cylinder. Okay, and so you fill the colostrum right to the top of your measuring cylinder, and then you put in your colostrometer. So it uses the how much sorry, my physics, I learned all my physics in DM. The daya to jahan. What was it called in English? It's like like how much pressure that it gives to push up something, or how dense it is, or how dense the material is. Okay, so this is correlated with the amount of IgG that is in the colostrum. Right. So if it's in the green area, it means that your colostrum has high amounts of IgG. If it's in the red area, it means that your colostrum has insufficient IgG. All right. So in terms of specific gravity, if it's green, yes, you can feed it to your calves, which means that your IgG concentration is equal or more than 50 milligrams per mil. If it's yellow, you don't want to feed it to your newborn calves, but you can use it for your 1 to 2 day old calves. If it's red, definitely cannot feed to your newborns. You can use it for your calves that are 2 days old or older. Okay. Besides using that manual method, there's also this Brix refractometer that we can use. They can also give you your SG, or there's even like a digital refractometer that you can use. This one, you can just put your colostrum sample right on this area, and it's like it gives you a reading immediately. Okay, so anything 22% or more will indicate that it has good quality. So this just shows that there's 50 or more milligrams per mil of IgG. All right, and then in terms of so next will be quantity. So how much of milk do you want to give to your calves? So you want to give 3 to 4 liters in the first feeding, which is as soon as possible. Okay. And then in the subsequent feeding, which is about 6 to 8 hours after your first feeding, you want to try to get about 2 liters in, right? You want to try to get as much as possible, all right? And then the thing is, if your calves are suckling well, no problem, they will take to the bottle very easily, okay? However, if they are not suckling well, what we need to do is that we need to tube feed them using tube feeders. So this is an example of an esophageal feeder. So this goes straight into the esophagus, and because their rumens are not developed yet, right? So this goes straight into the abomasum. Okay, so this is how you want to use an esophageal feeder. Just want to share with you.
In here. So the first thing I want to do is get the calf's butt in the corner, get his head in between my knees, and hold it pretty tight so he's not moving around. Got my electrolytes ready. Put some lube, Vaseline, something on the end, so that when I pass it down his throat, it goes nice and easy. Crimp the tube off so you don't get any fluid moving. You can use this little gadget, but I don't. I just think it's too cumbersome. It's easier to use this. So I want to gently put it in his mouth. The key is to go really slowly and let him swallow it. So I'm just barely pushing on it, barely pushing. He's going to finally swallow it. Just barely pushing on this thing. The calf finally starting to swallow it. They usually jump a little bit. Bury the hard part of the tube clear to the teeth. That's the key to know that it's in their stomach. Lift it up and let it fly. But you'll see the hard part of the tube is right at the edge of his teeth. That's really important. Sometimes the calves will struggle a little bit right now. Don't worry about it. If you got it buried far enough, it's in the right place and you can't mess things up. This calf's doing really good. It's a little unusual how nice the calf's standing. One of the greatest inventions ever is calf feeder bag. Give them 2 quarts at a time. A couple hours later, it'd be best if you would take a couple quarts of milk. And later in the day, get another couple quarts of electrolytes down them. They need about 8 quarts if they're really scouring bad the first day. 4 quarts of milk, 4 quarts of electrolytes. Calf's starting to struggle just a little bit. His tummy's getting a little full. That's okay. Don't worry about it. No matter what, don't pull the tube out. If he starts struggling and you think you're going to pull the tube out, make sure you crimp it first. Okay, that's all there is to it.
This presentation was a production of the Animal Science Department at Purdue University.
All right, so just a few takeaway things from this video. I saw that Dr. Hilton, he actually introduced the esophageal feeder slowly, and it follows the swallowing of the calf, right? And then this is not milk, obviously. They were giving electrolytes here. And then another important thing at the end is that you saw that he actually kinked the tube as he pulls out the esophageal feeder, because you don't want fluid to enter the lungs of the calf, all right? You don't want aspiration pneumonia, all right? All right, so the next cue is, hang on. All right, so the next cue is your quickness or timing. All right, so time is definitely of the essence, which means that timing is very, very important where you give your colostrum to your calves, right? Because gut absorption of your IG, of your immunoglobulins, which are very large molecules, will decrease steadily over time, all right? So when the animal is about 24 hours, more than 24 hours after birth, your gut absorption of your immunoglobulins is close to 0. Okay, so if you look at this graph here, it shows the age of the calf at first colostrum feeding, right? Okay, so this is the time of birth, and when it was given colostrum. So you can see that if it's given immediately after birth, they could see that the serum IgG was about almost 15 grams per liter. However, the ideal one, they always say, is you want to give it before 6 hours, or ideal 6 hours. But you can see by the time it hits about 12 hours, it goes to about 5. And when it hits about 24 hours, it goes to about 2 already, and it just steadily declines. So the takeaway from this is that give your colostrum as soon as possible, preferably within 6 hours of birth, in order for you to ensure that there is rapid and good absorption of your immunoglobulins via the gut. Okay, so only calves that were fed colostrum before 6 hours had serum IgG levels of more than 10 milligrams per mil, which is what we want. So 6 hours is like your golden time. You want to use the 6 hours, right? All right, so going more into colostral antibodies. So these are the only IgGs that are present in the calf circulation for the first few weeks of life, right? Because you know that if they are still young, their immune system is still immature. They are not able to mount any response. They're not able to produce their own antibodies. So they fully rely on maternal antibodies, right? So if you can see this graph, it shows you your serum IgG and the age in weeks. So you can see here, your maternal antibody is the one that is predominant in the circulation. And then your antibodies made by the calf will only start to increase roughly about 5 weeks old. Okay, so if your calf does not receive maternal antibody initially, what happens is that it will be very vulnerable in these early periods. Okay, because it only can produce antibody later on in life. So there's a chance for like calf mortality to occur, diseases to set in. Okay, so I cannot stress how important it is for you to feed your neonates colostrum. Okay, as soon as possible. Okay. All right, so evaluating transfer of passive immunity. So your goal is that you want to get the IgG levels of your calves to more than 10 milligrams per mil. Okay, so you can do this by checking the total serum protein using a refractometer. Okay, so anything more than 5.5 grams per deciliter, excellent, excellent. So your goal in your dairy or goal in your farm is that you want to make sure that less than 20% of your calves have less than 5.5 grams per deciliter, okay, of your total serum protein. Because if you have more than 20% of your calves that have very low serum protein, it shows that there might have been failure of transfer of this passive immunity. Okay. Okay, so next one is that you want to take samples from your calves that are less than 5 days old, because if they are less than 5 days old, this is when you are able to evaluate whether they have received adequate amounts of colostrum. Okay, if you're interested in like colostrum and stuff like this, you can actually go online. You can find out more information on www.calfnotes.com. This one, they have a whole bunch on like calf rearing, colostrum feeding, management, stuff like that. Okay, if you're interested. All right, so moving on, we talk about management practices. So some management practices that we can do in order to prevent diseases include like naval care, identification or tagging of your animals, dehorning, castration, vaccination, as well as if there are any supernumerary teats, we can get rid of them. Okay. I won't go so much in detail because all these things you probably have covered during your ruminant production, right? I'm guessing. Yeah. Yes. No. Maybe. All right. So okay. Thanks, Alia. All right. So general perinatal and postnatal diseases. So what are some of the problems that we can encounter in our calves during the early stage of their life? All right. So if it affects the fetus while it is still intrauterine, while it's still within the uterus, it can lead to abortion. It can lead to mummifications. Okay, if it happens during the time of parturition, the time of birth, things like your dystocia can cause anoxia or hypoxemia. So not enough oxygen in your calves. Or if it's a prolonged dystocia, or if there's you're too vigorously trying to get it out of the dam, you can cause any skeletal or soft tissue injury. Okay, postnatal, if it's early, but within like 48 hours of birth, typically it's a non-infectious cause. All right, can be metabolic, meaning that for example, like the metabolic acidosis, or maybe like hypoglycemia, things like that. Okay, if it's delayed within 2 to 7 days, so it is a failure of transfer of passive immunity. So just be clear of the way you word this. It's failure of transfer of passive immunity, because you want to transfer the passive immunity. It's actually not the failure of passive transfer, because a lot of people like to say failure of passive transfer. Passive transfer is actually a transfer that happens passively. Okay, you're not talking about the immunity that's being transferred. We are talking about the transfer that happens passively. That's failed, which is not the case. So you always think about FTPI, failure of transfer of passive immunity, if you want to have the wordings correct. All right. Besides that, you can also have a colibacillosis, so like your E. coli, for example, which can cause joint ill. Joint ill is when you have like enlarged joints of your calves or your kids. Any rota, as well as your coronavirus. This is a different coronavirus. Late would be between 1 to 4 weeks. Late onset entry diseases or respiratory diseases. All right. So when we compare between your dairy production and your beef production, we can see that the top problem is always your respiratory problems, followed by digestive problems in dairy and calving problems in your dairy cattle. And then beef, yes, respiratory is at the top, Next will be your weather-related causes, because you know beef animals are normally kept outside compared to dairy animals that are normally kept like indoors, right? And the third one would be your calving problems with your third one, right? So these are your main things that can cause death in your calves. So when we talk about respiratory problems, the first one is respiratory acidosis that can occur, like during dystocia, because you don't have a good exchange of good expulsion of your carbon dioxide, for example. Besides that, you can also have aspiration pneumonia, so from any liquids or like from meconium, or if you don't use your esophageal feeders properly, right? This can cause aspiration pneumonia. Meconium is like, do you know what meconium is? Right, some yes, some no. Okay, so meconium is actually the first species of the neonates. So it's typically very bright yellow in color. I don't know whether you've noticed this before. Like you see in calves, or if you see in kids, the first time they poop, it's like very bright yellow. So this is the meconium that that is the first species. If you see previously, if you see here, do you notice that this kid is covered in like yellow color stain? So this is actually meconium. If you deliver calves or kids or any neonates for that matter, and you see them stained yellow like this, it shows that fetal stress has occurred. That means intrauterine, the fetus is very stressed, maybe lack of oxygen, which goes to show that you need to remove it from the uterus environment as soon as possible. If not, the kid will die. Okay, so that's one. Okay. So moving along, so a bacterial pneumonia can be caused by your sepsis, aspiration pneumonia, bacterial contamination. So these are many factors, so such as your Pasteurella, your Manhemia, Histophilus, as well as your Mycoplasma. Right? You have vaccines for this, so if you have goat farms or you attend to farms that or in the future when you go out and you practice ruminant, for example, I highly encourage you to vaccinate your goats against these problems because they can cause a lot of deaths. Viral pneumonia from your BHV1, IBR, BBDV, as well as your parainfluenza. I won't cover so much in this because you will learn more about this in your ruminant diseases. So diagnosis, you can auscultate, you can do radiographs, you can do swabs, washes, lavages, and in order for you to culture to see what is your etiological agent. Okay. So treatment and preventions really depends if it's a bacterial of origin. You know, you can treat it with antibiotics. So trimethoprim sulfa is a good combination. Florphenicols, a bit difficult to find in Malaysia. Tilmycin is not really very common. Tulathromycin, also I don't really see that. Some like to use enrofloxacins. You can use that. Erythromycins, tetracycline, ceftiofurs, tylosin, fosfomycin. But you know, with the whole big thing about AMR right now, you know, antimicrobial resistance, we try not to go so high end in our antibiotics immediately. You want to try something that's more broad spectrum. So maybe your trimethoprim sulfa, you can go with something like your first generation cephalosporin, or maybe like your penicillins initially, okay, before you go into like more specific things like your third generation cephalosporins like your ceftiofur or your enrofloxacins, right? Does that make sense? You all took pharmacology already, right? Okay, so I'm not speaking another language. Okay, great. So next would be diarrhea or scours. So diarrhea or scours is very common also in your calves. So you can see like this, the back end will be stained with like this pasty kind of feces. All right, so this is quite bad. You can see it's very watery. All right, very bad conditions is when you see like hemorrhage together with the diarrhea, right? And sometimes you can even see like the mucosal lining will be sloughed off. So you see like pieces of tissue together with blood and feces. So these conditions are quite bad. So this is like a little cheat sheet or graph for you guys for the age of distribution of enteric diseases in calves. So typically under 5 days, if you see diarrhea under 5 days, normally caused by your E. coli, chronic E. coli, or can be caused by your coronavirus as well. But if you see diarrhea in your calves that are a bit further along, so maybe like 21 days, like 3 weeks onwards, you know it's not caused by your Clostridium or your rotavirus, for example. Okay, this will be mostly like your coccidia. Okay, So this is just like a little cheat sheet for you guys to just go through. All right, so the big six causes, which means the six causes of diarrhea in animals less than 21 days of age are your enterotoxigenic E. coli, your rotaviruses, your corona, cryptosporidium, your salmonella, as well as your nutritional problems. Okay. And then much rarer causes include your Clostridium perfringens type C. This one can cause sudden death. Your attaching and effacing E. coli, as well as Giardia, Brida, Toro, Pavo, Astro, Calici, as well as your BVD. Okay, so these are more rare. These are your more common ones, right? So if you see animals or your calves with diarrhea, these are the things that I normally think about initially before we go to all this. Okay. Okay, so your treatment goals when you want to talk about diarrhea is that, first of all, you want to correct dehydration, okay? Because you know there's a lot of fluid that's being lost from the diarrhea itself. Sometimes people have the mentality that, oh, the animal's having diarrhea, is losing a lot of fluids, so I need to stop the animal from losing lots of fluids. So what I do is that I will stop fluids. If I don't give fluids, so the animal won't have any fluids to excrete out. But you cannot do that, because if you do not rehydrate the animal is going to be totally dried out, and then can cause a lot of problems, organ failure, stuff like that. Okay, you don't want to dehydrate the animal. So the more the animal is like pushing out, the more you need to rehydrate the animal. Very important. IV fluids is your go-to. Oral electrolyte solution, if it's able to keep it down, very, very important. Any acid-base balances you need to correct, because if there's a lot of diarrhea, what happens is that there's a lot of loss of bicarbonates. Okay, so you get a metabolic acidosis. So if you get metabolic acidosis, it causes havoc in your blood pH. So the moment your blood pH is not imbalanced, it causes a lot of other derangements within your body. Incidentally, do you all know what's the pH of blood? You can just type it in the chat. What's the pH of blood? Six to 8. Wow, so wide. Cannot, you'll be dead already. Be a bit more specific. 7.3, 7.4, 7.1. What else? 6.8. But that's it. Only 4 answers. Oh, guys, there's 102 of you here. 7.3. Oh, you're very shy. Everybody message privately. It's okay. We all will learn together. So your typical, yes, correct, Mira, it's between 7.35 to 7.45. So just remember 7.4 is your blood pH plus minus 0.05. Okay. Anything other than that is too high or too low. 6.8, 6, way too low. You cannot send to everyone, doctor. Wait, hang on. Is it because of a setting? Chop. And store. I'll play with this later, guys. No wonder everybody's sending privately. I'll play with this later. All right. So next is like you want to provide nutritional support because you know your calves are in negative energy balance. Okay, so you need to give them nutrition, and also you want to facilitate repair of damaged epithelium. So this can be done by giving adequate nutrition. Right. So some antibiotics that you can also consider include like your sulfa, your trimethoprim, sulfas again, your mycin, penicillin, sativofos. But however, you have to remember if you're treating food animals, livestock, you do not want to give gentamicin. The reason why you don't want to give gentamicin is because gentamicin has a very, very long withdrawal period. So some instances have said like they require a withdrawal period of up to 18 months. which is a super long time. And then some have also seen that the gentamicin actually stays inside the kidney for a really, really extended period of time. So if we are treating animals for food, do not use gentamicin because your residues will be there. Okay. Gentamicin you normally see it in either your small animal or your horses, because typically in Malaysia we don't eat horses. All right, so some naval diseases. Okay, so when we talk about naval diseases, you want spontaneous rupture to occur as much as possible. You want it to happen spontaneously, and then the urachus and the vessels will retract into the abdomen. Okay, and then however, in about 5 to 15% of newborn calves, they will experience this inflammation of the umbilicus, otherwise known as omphalitis or navel ill. Okay, so what happens is that there will be bacterial contamination, and there's easy entrance of bacteria into the bloodstream. Okay, so what happens? Is that this one can cause systemic infection, septicemia. This can lead to your joint ill. Okay. Other reasons can also be if you cut the umbilicus too close towards the body, or you don't give any disinfectants on the umbilicus. All right, so you can cause infection to occur. All right, leads to reduced growth, joint ill. Okay. So this is an example of omphalitis. Can't really see, but you can appreciate there's a bit of yellowish here because there's a bit of pus. And if you palpate, normally it will feel warm, it will feel swollen, it will be painful, and you can see that the stalk of the umbilicus normally is like maybe 1 centimeter in diameter, but it will feel much thicker than that sometimes. All right. So this is what it looks like if it's a dry umbilicus. So this is what you want it to look like. Like this is like about 24 hours, 48 hours after giving birth. You can see that it's already starting to shrivel up. Okay. And then typically when I disinfect the navel, I will disinfect not only the tip of the navel or tip of the umbilical cord, but right up to the base. Right. Make sure everything is like covered with your disinfectant. So some things you can use include your tincture iodine, your iodine tincture. Normally I just go straight for 7%, or you can even use like 0.5% of your chlorhexidine. Okay. You can put it in a clean cup or put it in a dip and just kind of dip it. But if you've seen warts they have like the squeeze bottles, right? So you can actually also use the squeeze bottles and just kind of squeeze it all over. You just want to make sure that it's properly disinfected. Okay. Right, so effect of disinfecting versus not disinfecting the navel. So this was a study done by the University of Wisconsin. Then they saw that if you disinfect your calves, the percentage of mortality was much lower than those that were not disinfected. And those that had pneumonia were also less than those that were not disinfected. So you can see that by just this simple act of disinfecting the navel, it will help to reduce your mortality. All right. Okay. So finally, just 4 things that for you to think about when you want to talk about principles of control and prevention of diseases. All right. So the 4 principles are: first of all, you want to remove the cause of the disease. Second, you want to remove the neonate from the area where there is a lot of disease or agents. Third, you want to increase the non-specific resistance of the newborn. And fourth is you want to increase the specific resistance of the newborn. All right, let's just break this down a bit. Okay, remove the cause. So how you can do this is that you can make sure that your calves are born in a clean and dry, sheltered area. Okay, so clean, dry, sheltered area, not moist, not humid. So you want to make sure that the area is relatively dry and without any infective agents, for example. So you can see in this picture that you can see like a lot of white color in this pen next to here, because they normally put a lot of lime as a form of disinfectant. They cover the whole pen before they put in new animals. Okay. Navel, as I mentioned just now, swab it with your iodine or chlorhexidine. If it's in a heavily contaminated environment, you can think of like gating the umbilicus. Okay. And you want to supervise parturition, especially if you're dealing with cows that are giving birth for the first time. So your first calf heifers, they're giving birth for the first time, you know that there is a tendency for them to have dystocia, so you want to supervise them. Okay. Next is you want to remove the neonate from the area. If it's from a really overcrowded area, you can just kind of remove the neonates put it into an area that's not so crowded. Okay. You can separate from the adults. So this is what is being done in your dairy farms. Because your adults tend to shed enteric pathogen. All right, so if you remove the calves from the adults, it reduces the transmission of any enteric pathogens. All right. You can even house your calves individually. It avoids navel sucking between the calves and other direct transmission of diseases. Okay. You can also do it all in, all out principle of successive population depopulation. This one is mostly in your poultry farms. Not sure if you all did your LI last time. Normally they do an all in, all out system. All the chicks come in, and then all the chicks go out, or all the broilers go out at the same time, right? They don't come in like at different periods of time. So it's easier to disinfect. However, it's a bit more difficult to do this in your dairy or beef farms because it's almost impossible to get all the animals in at one time and get it all out at one time. Right? So this is just something that's ideal. If you have any of you been to Muazzam Shah before? Have any of you been to Muazzam Shah before? Do your practical. You just type or react, right? Yeah, so if you've been, so this is what it looks like. It's quite nice because you have individual calf pens where they can just just calves just chilling in their own individual pens. However, they do still have contact with each other because they are adjacent to each other, right? In comparison to, so this is in Indiana. This is a place where I did my PhD last time. So this place is called calf land, whereby if you see each hutch or each house here houses individual calves. So there is no contact between each calf. All right, there's no contact between each calf. I mean, they can pretty much see each other. And then this like little tractor here goes around and they bottle feed the animals. So the whole cart behind the tractor here is like full of milk, bottles of milk. So they just like kind of drive past the hutches and they just kind of put the bottles of milk because there's so many to cover. So this is what it looks like. So these are your older calves. So your older calves, they have like a feed bucket as well as a bucket for water. That you can, yeah. So it's nice. So this you can individually house them, and the little calf hutches also kind of like protect them from the harsh environment. Especially during winter, it can get really cold. It can get rainy or a lot of snow and a lot of wind. So it helps to protect the calves. All right. So third portion would be to increase non-specific resistance of newborn. So how can we do this? Is that we can provide colostrum. Right, so we can optimize the transfer of passive immunity. So remember the 3 Qs that we have? Do you remember what the 3 Qs are? First Q is?
Quality.
Quality. Thanks, Farha. Second Q is?
Quantity.
Quantity, yes, excellent. And third one is?
Quickness.
Quickness.
Yeah, good job, guys. Right, 3 Qs. So if this comes out in the exam, you all can answer, right? I'm not saying that it's going to come out in the exam, but if it comes out in the exam, you can answer, right? Yes, can. Okay, great. So if you don't have enough colostrum or if you don't have enough milk, what you can do is that you can give milk replaces. All right. Next is that you can provide warmth, quite important, especially for neonates. They're not able to regulate their body temperature very well, so you can give warmth. You want to prevent any stresses, so initially you don't want to transport them, you don't want to move them around too much when they're just born, right? So ultimately, good management and care, nutrition, hygiene, ventilation, housing, good husbandry is really, really important to increase non-specific resistance, right? So this is an example of giving warmth. So this is not because the white balance is off. It's because they use a heated lamp that is like a yellow heated lamp for calves, right? So all these calves, they're indoors. There's a heated lamp above them. They're in straw bedding, so they are warm, right? Or if you go to pig farms, you can see like they have this like infrared lamps or this little lamps that hang right near where the piglets can just kind of stay under and just kind of keep themselves warmer. Okay. All right, and then finally is to increase your specific resistance. So what you can do is that you want to make sure your dams are vaccinated so they can pass on that immunity down to their calves, to their babies. All right, stimulate production antibodies. right? Colostrum, okay, right? There's also this thing called about vaccinating the fetuses that are a bit older in utero in order to stimulate specific resistance. Like, for me, this is more of like a research kind of perspective, because how practical is it to actually vaccinate like fetuses inside the uterus? Not so practical. But however, some people have seen it to have benefits, but for me, in terms of practicality, not great. Vaccination of newborn, there's also pros and cons, because you have to think about the you want to protect the calf, but at the same time, you also have interference from your maternal antibodies as well. And your calves may be too young to actually mount any immune response. So this is all kind of iffy, right? All right, we're done. So objectives for today, hopefully for the past hour, you're able to understand and able to provide critical care to newborns, as well as to identify common diseases of neonates and corresponding treatments and preventions. Any questions, guys?
Hi, doctor. I have a question. I just wanted to confirm something.
Yes.
You know about putting the calves into recumbency and then swinging them and suspending them and stuff like that, right? To remove mucus. Like, is it compulsory to do for all cows or just cows with like a lot of excessive mucus? Yeah, that's my question.
Compulsory for which one? For all of them, is it?
Yes.
For me, compulsory would be putting them on sternal recumbency, right? And then you want to check your ABC, right? If there's a lot of mucus, you can remove via suction, syringe, or vacuum. I do not encourage you to swing your neonates. I do not encourage you to hang them upside down, right? But sternal recumbency is always my go-to. The first thing I do, put them on sternal recumbency. Like whenever we do any C-sections, we always need to have adequate numbers of staff available, or people or farmers or whatever, because you have your personnel that is dealing with the C-section itself, and you need to have a group that is dealing with the neonates, your baby group, right? So your baby group is the one that needs to resuscitate the calves. They are the ones that will need to put it on a sternal recumbency and make sure the calves are breathing. Right. So sternal recumbency for me, that's the most important part.
I see. Okay. Thank you so much, doctor.
Yep. Anything else, guys? You can type it in the chat if you don't want to talk. Okay, there's no questions. Let's take a 5-minute break. So it's 12:09. Come back at 12:15. We'll cover the rest of neonates. We'll cover small animal after this. All right. I'll see you guys in a bit. Okay, 1 more minute. Oh, I found the hammer throw video, guys. I'll throw the Matilda video. I'll share with you. So those who are not familiar, you can see this. Wait, can you hear? Yeah. Run again.
What are those?
What's what, Miss Trunchbull?
Hanging down by your ears.
You mean my pigtails?
Are you a pig, Amanda?
No, Miss Trunchbull.
Do I allow pigs in my school?
My mommy thinks they're sweet.
Your mommy is a twit. You'll chop those off before school tomorrow, or I will come around. But!
But!
Did you say but? Hammer throw. I'll give you but.
Good luck! Excellent release!
So please don't do that to little girls. And please don't do that to your cars. I think you guys can chat with everybody. Can you all try? If you chat, can everybody see? Ah, great. We're back. Okay. All right, continue. Continue. Any small animal people here? Any people that like small animal here? Oh, none.
None.
All right, a few. Type 1 in the chat if you do. 0 if you absolutely do not like small animal. 1 is okay. Yeah, quite a bunch of you. Great. Any large animal people here? Type 2 if you like large animal. Owa. Alright, so there's love for large and small animals. Excellent. What is Owa? Anyone care to explain? Oh, okay. I just know the ooh. Anyway. Alright. Record. Ooh, yeah. Alright, so welcome back everybody. So this is the second portion. We'll be covering small animal neonatology. Okay, so learning objectives for this next part is to understand what should be done for neonates after parturition, to know how to care for orphan neonates, to know common diseases affecting neonates. Right, so if you look at this graph right here, right, so this is a proportion of live-born puppies that were dying at different ages. It's a bit morbid, but you need to know this. Right, so this is the neonatal period up to about 21 days of age. And you can see on this left-hand side, where everything is in red, this shows you the mortality that happens during the first week of life. And if you see here, all these graphs, all these bars here, it shows that 48.1% of deaths that happen in puppies occur at the first week of life, which is quite a lot. Right. So when we talk about neonatal mortality, it is really high within the first week of life, and the pre-weaning mortality rate in dogs and cats ranges between 15 and 20%. So which goes to show that if your dog or if the bitch gives birth to 5 puppies, there's a likelihood that only 4 will survive, 1 will die. Okay. So 20% will die within the first 2 months, right? So this is pretty much a given. And then most deaths occur within the first week. So how do we want to prevent this from happening, right? So we always talk about prevention being better than cure, right? So the way that we can prevent is that the moment the puppies or the kittens are being born, we need to take steps in order to ensure the survival, as well as we need to be able to know how to evaluate whether the puppies or kittens will be able to survive or not. Let's keep going. So the whelping or the queening, so whelping is for dogs, queening is for cats, yeah? Whelping or queening is a natural process. And so what happens immediately after birth, right? So typically the dam will go around, will start licking the puppies, will start licking the kittens in order to stimulate them to move, stimulate them to breathe, okay? So licking the fetal membranes from the nose and the mouth, okay? And then the puppies itself will lick and nuzzle to maintain body temperature. So it is in their, it's in their blood, or it's their natural response to want to try to go as near to the dam as possible in order to stay warm. Okay. Then the dam will bite off the umbilical cord, right? And then she will encourage the neonate to suckle. So immediately after parturition, what happens? So same as just now, we talk about the ABC, but in this sense, we're talking about small animals, right? So rather than syringes, there's this thing called like a bulb syringe that you can buy. Normally they use this for babies. I don't know if you've seen this before. You can also get it from pet stores. It's like a syringe that it's a bulb syringe because it's like a bulb here, and it just functions to aspirate. So it helps you to just kind of aspirate any mucus or anything out from the puppies or the kittens, right? If there's any mucus, whatever that's blocking, you can do that. Next, you want to make sure that the puppies are dry. So in this sense, you can wrap them in towels or cloth or things like that, right? Just keep them warm. However, I do not encourage the use of hair dryers, especially if you put it on a high setting and it's a high heat setting. The reason why is because if you use it too vigorously, yes, your kittens and puppies will be dry, but you can over dry them and you can cause dehydration to set in instead, right? So you have to be very, very careful if you're using hair dryers. Normally, I would just put them in a warm environment and just kind of like dry or wrap them in towels, okay? Next, just like in your calves and your kids, you will make sure that you clean and disinfect the umbilical cord, okay? So this is what it looks like. Like this is the one that the dam has chewed off or ruptured spontaneously. You can see like the end of the umbilical cord is like kind of like tapers off, right? It's very different from an umbilical cord that has been cut. Because when you cut the umbilical cord, it's a very clean cut, and normally you see that the end will be like very straight or like or at an angle. Compared to if it's ruptured spontaneously, it's like a tapered end. So we generally want to encourage this kind of rupturing, spontaneous. Okay. We can examine the puppies and kittens. Okay, make sure that everything is intact, everything is there. And next, we can weigh the puppies and kittens. Okay, so this is just something that's very simple that you can have in your clinic, just a weighing scale for you to look at the birth weight of the puppies or the kittens, and you can actually do this every day to see that there is proper growth, proper weight development, proper weight gain of our puppies or kittens. Very simple. You can just do this once a day, and the scale won't cost very much, and it's a very good indicator of how your neonates are doing. Right. So there's another one that's like for babies. Okay. Have you ever been to the front office in UVH clinics here? Have you all been? Have you all seen? No, Amma hasn't. May happen, yes, right. So for those who have been, they have also like a little scale where they can weigh like the cats or like smaller animals. It's something like a baby scale. Maybe next time if you have an opportunity, you can have a look at the scale that's in the front office. All right, next is that we can look at the APGAR score. So what does the APGAR score actually mean? The APGAR score is actually a parameter for the assessment of puppies. So APGAR score is divided into 0, 1, and 2, and it breaks down 5 different parameters. First being heart rate, respiration, irritability reflex, mobility, or like how they move around, and mucous membrane color, right? So if you're able to evaluate this, you give it a scoring. If it scores between 0 and 3, there's severe distress in your neonates, so prognosis not very good for survival. 4 to 6, moderate distress. Prognosis slightly better, but still not great. Or if it's 7 to 10, meaning that most of it is around this area, there is no distress. So prognosis for survival will be good. So APGAR is actually the name of a nurse. So she came out with this scoring system for human babies actually, and the veterinary world adapted her scoring to put it in your small animal, in your puppies and your kittens. All right, so upon PE, what can you see upon PE? So at birth, your puppies will have typically a lower temperature compared to when they're at first week. Heart rate will also be slightly lower, respiratory rate also be slightly lower, okay? And then the behavior would be like, so they sleep throughout the day about 80% of the time, and they feed rigorously. Every 2 to 4 hours, they'll be hungry and like they'll be wanting to like suckle or be given milk. Pretty much like you guys are when you're staying at home during the MCO period. You sleep throughout the day, and then you only get up when you're hungry to go to the fridge. I don't know how vigorously you all feel, but anyway. So examination of the eyes and ears, the eyelids are actually closed at birth, and they will only start to separate or open up at about between days 5 to 14. Right? So there's no Menas reflex and there's no PLR reflex until day 21. Are you familiar with Menas and PLR? Menas reflex, okay, all right, great. PLR, pupillary light reflex. All right, good. External auditory canals only open from day 6 to 14 onwards, okay? So they're born blind and deaf, okay? So skin and hair coat, as well as to evaluate the hydration status. How do you do this? You want to look at skin and hair coat, any fleas, any dermatophytes present, right? Umbilical falls off about day 2 to 3. You remember the picture I showed you of the calf previously? It's all shriveled up and black. So it's a similar thing that you will see in your puppies and your kittens. If there's dehydration, you will see it to be more wrinkled and the skin will be less turgid. And you can also look at the eyes and the mucous membranes. If it appears a bit dry and kind of like kind of sticky, so you can tell that, okay, it's slightly dehydrated, right? And then when the puppy or kitten urinates, it's like very bright yellow, for example. So this one will show that it might be dehydrated, needs more water. Okay, because normally the urine will be a bit more dilute, light yellow in color. Okay. All right. So for the neural system, what are some things that you can evaluate? So the neural system in your puppies and kittens, they don't mature until about 6 to 8 weeks old. This is about 2 months old. Right. So, but they can still crawl, kind of suckle, kind of vocalize if they are distressed. Okay. If you do any withdrawal tests, it can be present, but it can be kind of a bit sluggish. So if you like pinch between the interdigital, it takes some time before they kind of like withdraw, for example. It takes a bit of time, right? Slow. So there are some responses that you can check to see whether they're actually responding well. So first is the rooting response. So rooting response is like you kind of make your hand in like a circle, and then you put it near the face of the puppy, and it is their natural reaction to want to push towards something that is warm, which is your hand. So this is pretty much how they will find the teeth of the dam. They will push towards something that's warm in order to look for the teeth in order for them to suckle. Okay. Next is suckle response. If you put like a finger into the mouth of the puppy, you can evaluate how quickly or how strong is the pressure that it suckles with. Okay. Writing response is when you put it on its back and you see how quickly or how well it turns itself like the right way again. Okay, so that's your writing response. Okay, as for musculoskeletal system, you can see the way that the puppy moves, evaluate the movement, palpate the bones and joints, make sure everything's okay. And at birth, they are able to lift their head up at birth. And for the first 7 to 14 days, they will be able to crawl around. And most of its weight is mainly on its forelimbs, all right, by day 10. By week 3, you can see they're kind of running around already. So 21 days. In terms of oral and abdominal cavities, you can see deciduous teeth by 6 weeks. So this is the baby teeth. You can see erupting by about 6 weeks. Permanent teeth will start to come in about 4 to 6 months. And then in terms of palpation, if you're a good palpator, you can feel the kidney, intestines, the colon, as well as the urinary bladder. The bladder is typically if the animal has not urinated yet, then you'll be able to feel. And then make sure there's a functional anus. Okay, you need to make sure that it's pooping and defecating well. Because if you're dealing with puppies and kittens with atresia ani, it can be a problem. It might warrant surgery or things like that. Okay, if you don't detect it early, it can cause bloat, constipation, things like that, which can lead to toxemia, and the puppies or kittens can die. Right? So how do you want to take care of orphan kittens and puppies? What do you want to actually do? Okay, first of all, you want to make sure that you maintain the body temperature. You want to make sure that they have adequate amounts of colostrum. Third, you want to make sure that they gain body weight properly. And fourth is you want to make sure that you are stimulating urination and defecation because they cannot go to the toilet on their own. So the first thing is maintaining body temperature. Right. So newborn puppies, newborn kittens, they have really lousy or very poor thermoregulatory capability. All right. So they're not able to regulate their temperature well. So which is why they always need to be close to their dam. They have almost no subcutaneous fat and very little insulation. All right. So they have a high surface area per body weight. Okay. So the heat that is lost, that is dissipated from them, is also very high. So it is if you're able to, encourage you to check puppies' rectal temperature before giving them their meals. If it's more than 34 degrees Celsius, okay, you can give them their meals. For example, if you're bottle feeding them, okay. If it's less than 34 degrees Celsius, you need to warm them up. All right. The reason why you need to have at least a 34 degrees Celsius body temperature is because you all know, in order to break down milk, what do you need? What are the things you need to break down milk or to break down food?
Enzymes.
Yes, you need enzymes. So in order to enzymes to function properly, they need to be within a certain a certain temperature range. Okay, if it's too low, what happens is that your enzymes will not work, and the milk will kind of become stale and not able to be broken down. Okay. So if it's hypothermic, kittens and your puppies are not able to digest the milk. And if you keep feeding, but the milk is not able to pass, it just stays in the stomach, what happens is that it just gets distended, and sometimes the milk will kind of backflow, and they will aspirate it instead. When when you get aspiration pneumonia, causes more problems. Okay, next is ingestion of colostrum. So like we talked about in large animal neonatal just now, so gives you passive immunity, all right? Besides that, also gives you energy. So this is just for you to remember. So from the milk, the energy is important for glucose maintenance, temperature maintenance, locomotion and suckling of the neonates, in order for them to digest food, and finally for growth. Right? So these are the 5 important factors in neonates especially, why they need colostrum, why they need milk, why they need the energy from the milk. All right, if you have your notes, don't look at your notes first, just look at the slides. True or false, so either T or F. Colostrum has higher immunoglobulins than plasma. Just type it in the chat. Yeah, right. So yes, so colostrum does have higher IgG compared to plasma. So if you look here, you look at this graph over here, it shows you the IgG concentration in terms of gram per liter. The blue bars are the ones are the the blue bars are your colostrum, and your red bars are your serum. So this is individual numbers of bitches. So they just took a sample size of a lot of dogs, a lot of bitches, and then they compared the colostrum IgG concentration with the serum concentration. For a majority of it, except for 2, you can see that the IgG concentration in colostrum is definitely much, much higher than in your serum. Alright, so next question. For hand-reared puppies, colostrum can be replaced with mature milk from another bitch. True or false? Can you use colostrum instead of using colostrum? Can you use like a mature milk from another bitch to feed your newborns? True or false? Yeah. So okay. So most of you answered false. So you are correct. So colostrum cannot be replaced with mature milk from another bitch because you have to remember colostrum is the one that's high in your antibodies, high in your immunoglobulins. If you compare it with the mature milk from another bitch, her milk will have very, very little immunoglobulins compared to your colostrum, right? And it's not suitable for your newborns. So this is the pattern of your IgG concentration in canine mammary secretions up to 21 days of lactation. So in your X scale, this is in terms of hours. So you can see the concentration of IgG in milk rapidly declines, right? The further it is from the time of parturition. Okay? So if you're using, for example, a milk from a dog that's like 100 hours after parturition, the amount of IgG is too low to provide adequate protection for the neonates, for the puppies or kittens. Okay, so you need to give it as soon as possible. Okay, final true or false question. Puppies can acquire passive immunity until 24 hours after birth. True or false? Puppies can acquire passive immunity until 24 hours after birth. Okay, all right, so mostly true. So the thing about this question is that it's whether you say true or false, I cannot say that you're wrong. The reason because if you look at this graph, you can see that, all right, absorption rate of your immunoglobulins in relation to your delivery time, and your x-axis is the age at colostrum injection, hours postpartum. So if you give it immediately after the puppy is born, yes, your absorption rate of immunoglobulins is very high. And then you can see it starts to reduce like half the concentration, half the percentage at 4 hours, and starts to go down. The moment you give it at 24 hours, there is still some absorption that occurs, but very, very, very minimal. So if you say that absorption still occurs at 24, I cannot say that you're wrong. But if you say that absorption doesn't occur at 24, so I can say that you are also not wrong, because it can be that the absorption is so little that is negligible. So the take home from this is that you want to feed your neonates, you want to feed your puppies and your kittens with colostrum. You want to make sure that they're latching onto they're suckling within like 4 to 6 hours after birth. Same like your calves, right? 6 hours, 4 hours after birth is the best time for your immunoglobulin absorption. Anything more than that, your chances of absorption will be less really. Okay, so now just want to go a bit more into why is it so important for these neonates to actually drink colostrum, right? So if you look at this, so this is the blood circulation of the blood circulation of the mother, and this is the barrier, the placental barrier, and this is the blood circulation of the fetus. Okay, you can see that in humans, primates, rodents, about 70% of maternal antibodies will reach the fetus via this transplacental route, right? 70%. However, if you look at carnivores, so carnivores are like your dogs and cats, right? The amount of maternal antibodies that reaches the fetus is only 20%. So at the time of birth, your puppies and your kittens only have about 20% reaching their circulation, which means that a majority of their antibodies needs to come from their colostrum ingestion. If you look at ruminants, so ruminants, sows and mares, even worse, less than 2% of maternal antibodies reach the fetus. And these antibodies itself are very fragile at the moment of birth. So it's even more important for your ruminants, sows, and mares to ingest that colostrum in order to have that high level of IgG in order to protect them. Right? This is clear. This is quite important. Is this clear, guys? Thumbs up or a 1? Excellent. So, carnivores, ruminants, sows, mares, very, very colostrum dependent. Okay? Alright, so we talk about milk replaces. I don't know whether any of you have experienced fostering or taking care of orphan puppies or kittens, but sometimes it can be difficult for us to get access to like original milk from the dog or the cat, right? Do you actually milk dogs? Do you actually milk cats? A bit difficult. So when we choose milk replacers in order to feed our orphan puppies and kittens, there are a few things that we need to make sure. The first one is that we need to make sure that there is no starch in the milk. The reason is because, like for our kittens, they do not have any amylase. They don't have the enzyme amylase in their system for the first 3 weeks of life. So they are not able to digest the starch. So if they're not able to digest the starch and you feed them milk replacer with starch, what happens is that they can develop diarrhea, right? And then next, we try not to give cows or goats milk if possible, because cows or goats milk is only able to give them energy. It is not able to give them specific antibodies, right? If you want to talk about just giving like energy, glucose, fine, you can give cows or goats milk. But in order to give them antibodies, no. Cows or goat milk can only give you cow or goat antibodies. It will not give you dog or cat antibodies. So what we can do is that we want to give as close to the maternal milk of the bitch as possible. So there is a product by Royal Canin, not sponsored, but there is this product by Royal Canin which is called Puppy Protect, which is great as a milk replacer because it is in a dry powdered form and it actually contains antibodies, right? So far it has been developed for puppies, not developed for kittens, but I have heard that some people also use it in kittens. So it comes in the form of like a little sachet. So this is like this is like the box. Can you see it? The box. Is it the balik? Is the writing upside down? Can you read this properly?
Yes.
Yes, alright, great. So it's like this little packet which has like milk in it, and you have like a little scoop for you to scoop the milk. And this is the bottle. It comes in 3 different sizes of nipples, or depending on the breed of your puppies, from like small, medium, or large breed or giant breed. And then it's a no-brainer because if you see here, can you see that? This is how they do in YouTube videos. Right, you can see that. So if you can see that how many numbers of scoops correlates with the amount of water that you need to put in to your bottle. Okay, and then if you see this a little influencer bites. If only I get paid, right? Anyway, so if you see this little gray sticker here, silver sticker here, what happens is that if your water is too hot, this silver sticker will show the word no. Alright, so until the water cools down to a temperature that is suitable for the puppies and kittens, then this sign of no will disappear. Then you know that you can feed it to your puppies or kittens. Right. So another thing that's important when you look at milk replacers is that you need to make sure that it also contains adequate amounts of folic acid. Because if you don't have enough amounts of folic acid, oh, I'm sorry, this folic acid is not for your puppies or kittens, it's actually for your dam. You need to make sure that your dams have adequate folic acid intake in their diet, because if not, what happens is that the puppies or kittens will be born with cleft palates. Okay, so folic acid important. So how do you want to feed your puppies or kittens? One is that you can do bottle feeding. So this is how you do bottle feeding. You need to make sure that the animal is in upright position. There are some pictures where they kind of like they put the puppies or kittens lying on their back and then they give the milk, right? So you don't want to do that because you can cause like choking or aspiration. So you want to put it sitting upright, like in this picture, okay? Then you give your bottle feed, okay? Or like this. Either way lah, but it needs to be sitting upright. You don't want it lying on its back, yeah? Always lying on its stomach or on its chest area. Right, so okay. Right, so tube feeding is when your puppies are not able to suckle well, so you actually use tube feeders. So this is a syringe attached to like a soft Foley catheter. And the way you want to do tube feeding is that, first of all, you want to measure from the nose to the last rib, right? And then you take 75% of that length. And then this is what you introduce into the puppy. You're going to wait for the puppy to swallow to make sure that it goes into the esophagus, right? Make sure it doesn't go into the trachea. Right, and then the amount that you can give is that the average stomach capacity of neonates is about 40 ml per kilogram. So when you feed, you can give about 20% of the body weight in 6 to 8 meals, or roughly about 2 to 4 meals per 100 gram. Right? Don't give too much, because your puppy will be too bloated. So this is an example of how tube feeding is done. Hang on, sorry guys, share computer audio. Tell me if you can't hear. Are you guys still there?
Yes, doctor, we're still here.
Yes.
Okay, great. Oh, gosh, my WebEx suddenly, yeah, my WebEx just closed. Hang on. Okay, tell me if you can't see the video, yeah? Or you can't hear the video.
Hold the puppy firmly. I'm going to insert the tube into the mouth. You see how he's swallowing? See the tongue moving? Okay. Now put the tube down close to that mark. I'll show you the mark in a minute. I'm holding it and I'm giving very slowly. I'm at 1 ml. I'm at 2 mLs. I'm at 2.5 mLs. Take the tube out gently. And basically, that was it. Now if we lay him down on his side and you hold the tube against him, you want the tube to end up about right there. Let's see if we can do it on the other side, because he's otherwise I'll get my trusty assistant. Please, trusty assistant, help hold him. Okay. You want to go from his mouth to about the end of the rib cage. Now if you remember, I had that black mark. That's actually for a bigger puppy. I would have marked him about right there. And when I insert it, it's important that you have the neck bent. It's real hard to get it down the windpipe if they're moving their tongue and if they're swallowing. But if you keep the neck extended like this, you see, if I was doing it with the neck extended, hard to see because he's so little. You know, but they would usually cough and they would probably object greatly.
Right. Right, so next thing that we want to do is that we want to measure body weight. So we want to weigh the puppies or kittens at birth, and then we want to do it daily. Okay, so initially kittens at birth about 100 grams. For puppies, it really depends on the breed. Okay, from your toy breeds up to your giant breeds, it has a big range, right? So if the animal is born with low birth weight, it usually will indicate poor survivability. You see, because it's correlated with a low body weight is correlated with low feed intake, low weight gain, stuff like that, right? And early growth rate reflects colostrum intake. So the way we look at growth intake is by measuring the weight of our puppies or kittens daily, because we can see any increase in body weight will show that there is growth. The moment we see a negative number, we know that there's problems already. It's either your puppy's not eating well, or not drinking well, or maybe got some disease happening. Okay, so the scale is a simple tool to measure birth weights, as well as any deficits in maternal antibody, deficits in energy intake. Right, scales, simple tool, a lot of information you get. Okay, next will be stimulating urination and defecation. So your puppies and kittens, your newborns, they are not able to go to the toilet on their own. Right. So if you don't stimulate urination and defecation, what happens is that they will be constipated. All right. The mom usually will do this, but if they are orphans and you are the mom, so you will need to do it. Okay. So they need to be stimulated to urinate and defecate for the first 3 weeks of life. This is the role of the dam. So normally the dam will like kind of lick the anal, lick the anus, lick the perineum portion in order to stimulate the puppies and kittens to defecate. But for us, we don't lick the anus or the perineum portion. So what we can do is that we can just use like warm or wet cotton balls, right? Just kind of wipe the urinary and anal openings to stimulate them to defecate or urinate. Okay. Share with you a video of how to do this. Next. Okay. Can hear?
Orphan kittens under the age of 3 to 4 weeks will need your assistance to urinate and defecate, as they are reflex eliminators. This video will go through the steps to help your kitten eliminate properly. Orphan neonatal kittens will need stimulating after every feeding, so be sure and have your equipment handy before you begin feeding. The equipment you need includes clean cotton squares or paper towels, warm water, and a container or cloth for the kitten to eliminate over. When you finish feeding and burping your kitten, position the kitten in one hand with his belly cupped in the palm of your hand and not on his back. Dip the cotton square into the warm water and then very gently stimulate your kitten's anus and urethra area in a circular or side-to-side motion with your other hand. You can position the kitten over a garbage can or over several layers of paper towel to catch the urine. As the kitten gets older, you can position him over the litter box. Continue stimulating for about 10 seconds after no more urine is coming out to give the kitten an opportunity to defecate as well, and to make sure the kitten's bladder is empty. Kittens need continuous stimulation to eliminate their bladder completely. The urine should be dilute yellow. If the kitten is ready to defecate, he will display some abdominal effort. Be patient and gentle while you wait for him to finish. Kittens typically defecate every 24 to 36 hours, and the stool should be brownish yellow, slightly firm, to toothpaste in consistency. If the kitten has loose stool or diarrhea, she may strain after she has finished defecating. Be sure and address loose stool and diarrhea with your veterinarian to avoid rectal prolapse from too much straining, and to address any infectious causes. If the stools are too firm and the kitten seems constipated, the kitten may be dehydrated, and this too should be addressed by your veterinarian. Gently dab the kitten's area dry after he is finished eliminating to help keep the kitten clean. You can use a warm, damp cotton square or paper towel to clean up after defecation.
Right, so the last portion of this is some common disorders that you can see in neonates. So they can be congenital defects, feeding puppy or kitten syndrome, neonatal isoerythrolysis, swimmers, or infectious diseases. Okay, we go more in detail. So, so kittens, some congenital defects that you can see in kittens include like cleft palates. So this was done on a survey of about 51 kittens. And for puppies, this was a survey done on 1,679 pups. They saw that congenital defects that were common included cryptorchidism. Cryptorchidism means that the testicles are not descended, patellar luxation, cardiac abnormalities with murmurs, cleft palates again, as well as umbilical and inguinal hernias. Right. So the picture on the left here is what it looks like for the hard palate that is fused, and this is what it looks like if there's cleft palate, right? There's no fusion, and this is what it looks like. This is pretty bad cleft palate. So in instances like this, the puppy or the kitten will not be able to suck properly, to suck the milk properly, because it's not able to latch and create that vacuum. And also it can also cause aspiration pneumonia. So can have problems if your puppies have this. As for fading puppy or kitten syndrome, these are your neonates that are born weak, fail to thrive, or they start off very rigorous, but then they slowly start to kind of lose their passion for life. This is kind of weak, and then they die about approximately 1 week old. This is get weaker and weaker. So there are many causes for this syndrome. For example, like septicemia, environment, or even like low birth weight, as we mentioned earlier. Hypothermia, decreased colostrum ingestion, as well as immunodeficiency will predispose all these puppies and kittens to secondary infection. Okay, and subsequent Subsequently, they can develop a hypoglycemia, dehydration, cardiopulmonary failure. Okay. I'm just breezing through because it's just very briefly. Yeah. Next would be neonatal isoerythrolysis. So if you look at the word here, isoerythrolysis is lysis of your red blood cells. Okay. This happens in kittens, and why it happens in kittens is it is an acute disease, and why it happens is because of this. In cats, they have natural antibodies against a blood type. So, for example, if the cat has type A blood, it has anti-B antibodies, but its anti-B antibodies are kind of weak. But if it's a type B, if it has type B blood, it will have strong anti-A antibodies. So if it's a kitten that has a type A blood born to a mom with a queen with a type B blood, because the queen type B blood will have strong anti-A antibodies, right? So if this kitten suckles from the mom, the strong anti-A antibodies will go into the kitten, right? And then the kitten has type A blood, right? So these anti-A antibodies will attack the kitten's own red blood cells. So these kittens will be acutely ill after intake of colostrum because the kitten absorbs the anti-A antibodies, right? So there's high mortality rates in these cases, and you can see like in this case, like this little kitten here is like starting to turn a bit yellow, a bit jaundice. Okay, so what you need to do, you need to remove them immediately from the dams. You may need to do blood transfusion and maybe put them on milk replacers instead. Swimmers are like this, so they are like kind of swimming on land. So newborns, especially in newborns that are raised on smooth floors, they don't have grip. So instead of having good support on all their fours, they kind of split to the side, right? So when they walk, they can't really walk, so they kind of like swim on the ground, right? So they move with paddling movements. If you do not correct this as soon as possible, it can be irreversible. Right. So what you can do is that in order to prevent this, you can place them on surfaces that have a bit more traction, like towels or carpets, things like that. Or you can even hobble the legs. Hobble the legs means that if the legs are split, you just tie it together, like with a string or like a band or something like that, a gauze or something, just so that you can just adduct the feet together so that it doesn't splay, right? So that, and then physical therapy, like you got like massage, got to like increase its range of movement, stuff like that. All right, and then finally for infectious disorders, your puppies can get like herpes virus, your infectious canine hepatitis, canine distemper, kittens upper respiratory infection, panleukopenia. Your puppies also can get your parvola, feline leukemia, feline infectious peritonitis, stuff like this. This one will be covered more in your FCM class, your feline canine medicine class. Okay. All right, congrats guys, we made it. So hopefully you understood what should be done for neonates after parturition. Now if you see any orphan neonates, you know how to take care of them, at least the basics, as well as you know the common diseases affecting neonates. Does anybody have any questions? Feel free to unmute yourself if you have any questions, or you can type it in the chat if you don't want to talk. Or if you can't think of anything at this moment, I think Putra Blast also has a forum that you can type questions in. All right, you can ask questions there. Or if you don't want to type in the forum, you can also email me. My email. This is my email. If you have any questions, you can feel free to email me. I will try to respond within 24 hours. Okay. Right. Everybody good? If everybody good, give a thumbs up. No more questions. If there are no questions. Okay, great. No questions. Thank you for your attention. All the best with the rest of the semester, and then I will see you. Okay, sorry, wait. Zining's question. Sorry, doctor, if the queen is type A, neonate is type B. Yeah, that one not so much of a problem. Not so much of a problem. It's a big problem if your queen is B and your neonates are A. That's more of a problem. Yeah. Anything else? Okay, there's nothing. All the rest for the rest of the semester, and I will see you next sem. All right. Okay, guys. See you.